So how do we stop MTBIs before they happen? First of all, it's important to counsel your patients and their parents about activities that increase the risk of MTBI and provide them with information regarding brain safety. These tips should focus on teen driving or car and booster seat safety, injury prevention during recreational activities, such as while riding a bike and playing on playgrounds, gates and other fall safety strategies, and sports injury prevention, including promoting a culture of safety in sports. We will now cover each of these topics in more detail. Remind parents to make sure children are always properly buckled up in a car seat, booster seat, or seat belt, whichever is appropriate for their age, weight, and height. Check out our resource center for more motor vehicle safety tips. Parents can get assistance from a certified child passenger safety technician. Reinforce that parents should never reuse a car seat that appears cracked or damaged, if it has been recalled, if it does not have an expiration date, model number, instructions, or if it has been in a crash. For parents of teens, be sure to share proven strategies that can improve the safety of young drivers on the road. These strategies focus on what we call the 8 danger zones. These include driver inexperience, driving with teen passengers, nighttime driving, not using seat belts, distracted driving, drowsy driving, reckless driving, impaired driving. You can download information on what parents can do to keep teen drivers safe, details on car and booster safety, and get more motor vehicle safety tips in the Resource Center. Other steps parents can take to help reduce the chance for concussion and other injuries relate to when their children participate in recreational activities. For example, children and their parents should always wear a helmet when riding a bike. The helmet should fit well and be well maintained. Remind parents that bike helmets that have been damaged or have had an impact need to be replaced. Falls on the playground are a common cause of injury. Parents can check to make sure that the surfaces under playground equipment are safe, soft, and consist of appropriate materials. This includes wood chips or sand, not dirt or grass. You can get more information on helmet fit and care for bike and other helmets, as well as playground safety in the Resource Center. Falls are the most common cause of MTBI among children. Thankfully, most falls can be prevented, and parents can play a key role in protecting children. Counsel patients in fall prevention tips to help. For example, encourage parent to use home safety devices such as guards on windows that are above ground level, stair gates, and stair rails. These devices can help keep a child from taking a dangerous tumble. Young children should be supervised at all times around fall hazards, such as stairs and playground equipment, whether at home or out at play. Sports injury prevention should start in the preseason, and preseason planning involves 5 steps. These steps can help reduce the chance of injuries throughout the season. First, healthcare providers should assess the premorbid history of young athletes as a part of pre-participation athletic evaluations. Be sure to counsel patients and their parents that their league or school should have an MTBI action plan in place before the first practice. The second step is to define roles. If you will be working with other healthcare providers with a sports team, define each of your roles in the event of an MTBI. For example, ensure immediate response by outlining who will be responsible for the field response, conduct the emergency assessment, observe the athlete on the sideline, make the decision about disposition. Step 3. Know availability of EMS and trauma centers and conduct emergency drills. Step 4. Conduct preseason baseline assessments. Determine whether the league or school should consider conducting preseason baseline assessments. This includes a clinical assessment exam involving an MTBI symptom checklist, a cognitive exam, and a balance assessment for each athlete. Ideally, this clinical assessment exam will be used on the sideline following the injury to assess for changes if an injury occurs. Baseline neuropsychological testing may also be used as a helpful adjunct. These tests assess brain behavior relationships including memory, concentration, information processing, executive function, and reaction time. Step 5. Talk with coaches, parents, and athletes. Even before the first practice, you should talk with coaches, parents, and athletes about MTBI, its dangers, potential long-term consequences, and any other concerns specific to their sport. Remind coaches and parents that their actions create the culture of safety for the team. Here are some ways to help. Discuss ways to lower the chances of getting a concussion. Every sport is different, but there are skills and techniques athletes can use to avoid hits to the head. You can check out the Resource Center to get posters on concussion safety for a variety of sports. Create an environment that includes positive messages on concussion reporting. Talk with athletes about any concerns they might have about reporting their concussion symptoms. Make sure to tell them that safety comes first, and you expect them to tell you, the coach, or their parents if they think they have a concussion. When athletes hear positive messages and praise regarding concussion reporting, they are more comfortable reporting the injury. Expect, model, and reinforce safe play. Aggressive and/or unsportsmanlike behavior among athletes can increase their chances of getting a concussion or other serious injury. Make sure that coaches and parents enforce the rules of the sport and that athletes avoid unsafe actions. Finally, remind parents and coaches that sports helmets were not designed to prevent all MTBIs. They were developed to prevent catastrophic injuries, such as skull fractures, subdural hematomas, and epidural hematomas. An MTBI-proof or concussion-proof helmet does not exist today. Other personal protective equipment, such as mouthguards and headgear, help prevent dental injuries and facial lacerations, but there is currently no evidence they prevent MTBIs.